The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
School districts say they're seeing a sharp increase in walking pneumonia cases and are sounding the alarm to parents. News 8's Kyla Russell breaks down exactly what it is and how to make sure that your family is protected.
Diversity, equity, and inclusion are priorities at Community Health Network. With our commitment to DEI, we're able to create a stronger health system by supporting and uplifting everyone. Through community outreach, education, health equity, recruitment and retention, and supplier diversity initiatives, Community Health Network will continue to bring DEI efforts to the forefront of what we do.
Health Spotlight is presented by Community Health Network. For more information or resources, go to wishtv.com/health-spotlight.
Walking pneumonia doesn't typically present as severely as pneumonia, so much so that patients can continue walking and going about their day-to-day lives. But its impact can be severe, especially in school kids.
That require admissions to intensive care units. Children die, adults die of it. Sometimes it invades the brain and it can cause an infection there.
This is a message sent out by one Indy school urging parents to contact a doctor sooner rather than later if their child presents symptoms of walking pneumonia. About 2 million people are diagnosed with the disease each year, but this year is different.
But what we've seen this summer, starting in July, August, was an explosion in the number of cases.
Riley infectious disease doctor John Christensen has seen that explosion firsthand here in central Indiana. He says the symptoms are common, typically starting with a sore throat, cough, or chest pain.
A bacterial infection caused by a bacteria called mycoplasma.
It typically impacts teenagers most, but what's not typical? A surge among kids born during lockdown. The CDC says kids 2 to 4 saw a 6% increase in diagnoses between April and October.
Saw a rebound after COVID.
During lockdown, people were wearing masks, staying home, and were not at school and work.
And so what happened was a lot of people who could have acquired an infection around that time didn't. So now they're all susceptible. So now you bring in a new germ or an old germ into an environment and it spreads like wildfire.
As the holidays roll around and gatherings begin, Dr. Christensen is heeding a similar call to area schools, especially in severe cases.
And that's when you need to take them to their healthcare professional that they haven't seen, and in some cases get the x-rays.
In addition to making sure you contact your doctor, physicians say it's important you make sure your family is up to date on all of their vaccinations.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.